So we are live now. So very good afternoon, everyone. Thanks for joining in for today's session. We have a Dr. Pankaj Gupta from Manipal Hospital, Dwarka. He has worked at top institute in the world like NHS-England, AIIMS New Delhi, and Indraprastha Apollo Hospital, New Delhi. He has over 19-year experience in surgical. So over to you, Dr. Pankaj Gupta, and thanks for joining in.
Hi, good afternoon, everyone. Thank you, ma'am, for the nice words. I bring greetings from my hospital, that is Manipal Hospital Dwarka, where I am working at the moment as a consultant robotic, bariatric, minimal access and GI surgery. I take this opportunity to discuss very common surgical issues that we see day and night, and there are many myths associated with such common diseases in our society. So I will start. I will try to be as brief as feasible. So basically, I will be discussing three topics today. One is gallstones, hernia, and hepatitis. So let's start with the gallbladder stones. Am I audible, ma'am?
Yes, sir, you're audible.
Yeah. So as we know, the gallbladder is a very common disease. We see day and night. It's fairly common, but the cause of the gallstones is unknown. Like any other medical conditions where we don't know the cause exactly till date, we also don't know the cause of the gallbladder stones. Why the stones develops in the gallbladder, we don't know. Basically, it is a dysfunction of the wall of the gallbladder that leads to the formation of stones in gallbladder. In the simpler terms, basically, if I say if the gallbladder doesn't function properly, then gallstones develop. A very common myth associated with the gallbladder stones and its management is that gallbladder produces bile. It is a myth. Gallbladder doesn't produce any bile. Basically, the bile is produced by the liver. Let me briefly describe the function of the gallbladder. Here we can see in the image, we can see the liver. This small globular structure is known as the gallbladder. It is attached to the liver by these small ducts. This is pancreas. This is part of our small intestines. Basically, the bile is produced in the liver. Liver produces around 1.5 liters of bile in 24 hours. Whenever we have empty stomach, what happens? Out of this 1.5 liters of 1500 ml of bile, just 30 to 50 ml of bile is stored in the gallbladder. When we eat something, the gallbladder wall contracts and this 30 ml bile goes down into our small intestines via this duct. It helps in the initial phase of the digestion. However, the significance of this 30 ml is very less. And secondarily, when the gallbladder has turned into gallstones, it has stopped its function. So gallbladder is practically not helping the individual with gallbladder stones. So what are the complications that can occur due to gallbladder stones? Why do we need to treat the gallbladder stones? Broadly, there are four complications. One, what we call is acute cholecystitis, या जिसको हम कह सकते हैं कि gallbladder में infection हो जाना. Gallbladder का stone अगर कोई gallbladder की neck पे stuck हो जाता है, then what will happen? The gallbladder, there will be inflammation in the gallbladder, there will be infection in the gallbladder, or there may be pus formation in the gallbladder. It may, though rarely, but it may lead to the perforation or rupture of the gallbladder. The second common complications that we see is what we call as cholangitis or obstructive jaundice. In simpler terms, see, let me go back to my previous slide. Here I can see, I think we can appreciate the gallbladder and not be better in this slide. If there is stones multiple stones in the gallbladder, and one of the stone passes via this duct and comes down what we call as the bile duct or common bile duct, what will happen? The bile which is being produced in the liver will not able to go down to the small intestines. So there is an obstruction. This stone is causing the obstruction here. So what we call as obstructive jaundice. Another common complication is pancreatitis. As we can see in this slide, the bile duct joins with the pancreatic duct before opening into the small gut. So if a stone passes further down, it may lead to injury of the pancreas, which may lead to inflammation of the pancreas. Another common complication is cancer of the gallbladder. There is a funny fact about it. If a person harbors gallbladder stones for more than 10 years, out of 100, 2 patients will develop gallbladder stones. The incidence of formation of gallbladder cancer in patient of gallstones is 2%. However, the cause of gallbladder cancer is gallstones in 98% of the cases. If we say in simpler terms, जिस आदमी को गॉलब्लैडर में स्टोन्स हैं 100 लोगों में से 2 लोगों को गॉलब्लैडर कैंसर बनता है, बट जिसको गॉलब्लैडर कैंसर बना है उसमें we find gallstones in more than 98% of the cases. So what is the treatment of the gallbladder stones? The gallbladder stones treatment is cholecystectomy or removal of the gallbladder. There are 3 ways of doing the cholecystectomy. One is open, where we make a big cut on the belly and remove the gallbladder. The second is what we call as laparoscopy. Here we make tiny punches, generally 4 punches we do, and put a camera through one of these puncher, put instruments from rest of the 3 punches, go in and operate and remove the gallbladder. And the latest and most advanced technique is robotic cholecystectomy. The robotic cholecystectomy is a very advanced technique. It increases the precision of the surgery. What are the advantages of this minimal access surgery or the traditional open surgeries? First of all, instead of big cut, there is a small punches. So obviously there is less pain. Hospital stay is also less. More than 99% of our patient goes home next day. Obviously, bleeding is less because the cut is less. Chances of infection also decreases. Patient can resume his work early, and obviously better cosmetic results. The second topic which I'm going to cover today is hernia. What is hernia? अगर मैं उसको सिंपल टर्म्स में बताने की कोशिश करूं, I have drawn a simple diagram, but I would like to give another analogy for hernia. Everyone has seen the tire of the car. Sorry. There are 3 layers in the tire of the car. Outer one is the tire. Inside the tire, there is a tube. Inside the tube is air. If we compare the tire with our abdominal or our stomach wall, we can compare it like this: skin and the fat and muscles below the tire. It forms, we can compare it with the tire. Inside these muscles and abdominal wall, there is a lining, what we call as a peritoneal lining. It is nothing but like, envelope which is, which carries all of our intra-abdominal organs like intestines and omentum. We can compare that peritoneal lining with the tube, and inside that peritoneal lining lies the, as I said, intestines and all. So we can compare intestines with the air. If there is a defect at one point of the tire, what will happen? The tube along with the air will bulge out. The same happens in the hernia. if there is a weakness in the muscle layer, basically, what will happen? The peritoneal lining along with the intestines will bulge out from this defect. So this is what we call as a hernia. How do we repair the car tire? We put a patch over it. Similarly, we put a patch and repair the hernia. We call this patch as surgical mesh. Before coming to that, there are different types of hernia, which is probably, it will become boring for all of you. I'm not going to details of all this. There are different types of hernia. They are found in the different part of the abdominal wall. There are two common myths about the hernia. One, मेरे को तो hernia में पेन नहीं होता है, मैं इसका इलाज क्यों कराऊं? What exactly happens is, initially when the hernia starts developing, there is a pain. But जैसे hernia धीरे धीरे बड़ा होता है, पेन इनफैक्ट कम होता चला जाता है, but chances of complication बढ़ते चले जाते हैं. Second, hernia can be cured by medication. There cannot be any medication because it is an anatomical defect. टायर में अगर फट गया है, छेद हो गया, तो उसको पैच लगाना ही पड़ेगा. So as I was telling, how to repair the hernia, again like gallbladder, we can repair the hernia by 3 techniques. One is open, where we make a cut over the hernia, dissect the hernia, reduce the hernial content, put a mesh and repair it. Another way is by laparoscopy, where we make tiny punches in the belly, reduce the hernia, close the defect and put a mesh over the defect. And the latest, as I told, is the robotic. So here we can see these are all the pictures of laparoscopic hernia repair. We can see there's a defect. These pictures are taken from inside the abdominal wall. So we can see this is what hernia looks like from the belly. We can see the intestines is going into the hernia. Here in the next slide, as I think you all can appreciate, the content has been reduced. Nothing is cut. Nothing is taken out of the body. The content has been reduced. We have put a mesh over it. This is the surgical mesh, and then close the defect. This is how hernia is treated. The advantages of laparoscopy is same as was with in the treatment of gallbladder stones. Obviously, there is less pain, smaller scar, decreased complications, early return to work, better cosmetic results. These are the different types of the surgical meshes available to us, which we select according to the type of the hernia, where exactly the mesh needs to be put. So there are different type of meshes for different types of hernia. This instrument is, this is like a stapler. We have how to fix the mesh with the abdominal wall. I think in the previous slide, sorry, there is no, yeah, here we can see. These are the tackers. The mesh has been placed and has been fixed by this tacker. These are basically kind of, the staplers that we use in our day-to-day life. This is similar to those staplers. Another topic that I'm going to discuss today is hepatitis. Basically, in simpler terms, if I put hepatitis is basically inflammation of the liver. Gallbladder के ऊपर जो हमने लीवर देखा था उस स्लाइड में लीवर की स्वेलिंग को हेपेटाइटिस बोलते हैं. What are the causes of hepatitis? Basically, there are two causes of hepatitis. We can broadly classify them into two broad categories. One is the viruses, and another non-infective causes. The most common is alcohol. How this hepatitis is transmission? I'm talking about obviously the viral hepatitis. Hepatitis A and E is transmitted. Basically, there are 5 types of viruses that causes hepatitis. Hepatitis A, B, C, and D. A and E viruses are basically transmitted by fecal-oral route, means by contaminated water, contaminated food. And hepatitis B, C, and D are basically blood-borne. They are transmitted by, unsafe tattooing, unprotected multiple partner sexual contacts, by blood transfusion. There are two types of hepatitis basically, acute and chronic. Acute means acutely जो चीज उसी समय infection होता है उसको acute बोलते हैं. If it turns into long-term infection, we call it as a chronic. The symptoms are fairly common that we see in most of other diseases also, like jaundice, आंखें पीली पड़ जाती हैं, यूरिन का कलर येलो आता है, फीवर, वॉमिटिंग, loss of appetite, belly pain, and in chronic hepatitis, the symptoms are weight loss, fatigue, liver damage, and it may even lead to liver cancer. The diagnosis of hepatitis can be done by blood test, ultrasound, CT scan, liver biopsies. There are other tests also for hepatitis, which we do like endoscopic, ultrasound. What is more important for today's discussion is how to prevent hepatitis. Hepatitis A and C, as we discussed, are transmitted by fecal-oral route. So the best way of preventing hepatitis A and E is basically to maintain good personal hygiene, regular hand washing, avoidance of unhygienic food and water, especially in this rainy seasons. Another important thing how we can prevent hepatitis is vaccination. Thankfully, there are vaccination available nowadays for prevention of hepatitis A and B. Unfortunately, till date, there is no vaccination for hepatitis C and D. The ways to prevent hepatitis B, C, and D is proper screening of blood products before transfusion, single-use needles and syringes, avoidance of unprotected sexual. Another important myth is that there are various medication available in alternative medication which helps in the treatment of hepatitis. Unfortunately, this is not true. In fact, the most common hepatitis that is prevalent in the society is hepatitis A and E. And in most of the cases, hepatitis A and E is self-limiting. They doesn't require much of treatment. In fact, we avoid giving medication in hepatitis A and E because hepatitis, as I told you in the starting, is basically inflammation in the liver. Sorry. Liver is the organ which detoxify our body toxins. All the medication that we take goes through the liver. So if we give more of the medication, it will in fact even harm us more. And we really don't require much of the medication in hepatitis A and E. They are self-limiting. Obviously, it will take time. They generally take maybe 2 to 4 weeks to recover. The most important aspect of the management of hepatitis A and E is prevention of secondary infections, good hydration, and symptomatic treatment. Like for fever, we can give some drugs like paracetamol and all. But by and large, we avoid giving much of medication in hepatitis A and E. For hepatitis B and C, B, C, and D, in fact, there are various medications which are available in the market, which are given to the patients depending upon their stage and severity. Sometimes we also need to do liver transplantation if it becomes chronic. Thank you. Thank you.
Sir, I'll put a query on chat box. We have a
Yeah.
query.
The symptoms of hepatitis, I told you, depends upon the type of the hepatitis. Hepatitis A is basically A and E are transmitted by fecal-oral route, by contaminated blood, by contaminated food. The symptoms of hepatitis is basically fever, pain in the abdomen, loss of appetite, yellowish discoloration of the stools, eyes, and urine. Mr. Kaushik, this is, bit a difficult question to answer because nowadays the best way to treat hernia is with robotic surgery. The second best option is with the keyhole surgery. Basically, the advantages I have already discussed in my presentation of advantages of keyhole or robotic surgery over the open surgery is less chances of bleeding, less pain, early return to the work, better cosmetic results, and less chances of recurrence also. Another question, what causes hernia? Again, as I told you, the exact cause of formation of hernia is unknown, but sometimes, yeah, the muscle weakness may cause hernia. Like after some surgeries, if you might have heard, some after a patient undergoes some surgery in the abdomen and develops hernia. Basically, whenever we do a surgery, there's a cut in the belly. It heals by presentation. It heals, and if there's a weakness that persists, it may cause hernia. Hernia, is it urgent to treat hernia? Can I wait for sometimes? What are the repercussions of waiting? Okay. Sometimes, yes, it's urgent to treat hernia, but many times it may not be urgent to treat hernia. One may develop complication. Don't know whether patient will develop complication tonight or he or she may not develop complication for 1 month, 6 months, 1 year, 5 year. No one can predict. There is no scientific parameter by which we can predict when the patient will develop complications. Like complications, as we have seen in the slides, the bowel is going into the hernia. What are the complications basically? If the bowel is going into the hernia, if they are able to come back to the abdomen, if the swelling can be reduced, it's fine. Sometimes what happens, bowels get stuck or intestines get stuck in this abdominal wall defect. Then obviously it becomes hernia. Sometimes we may even need to cut the intestines to treat the hernia. How is hernia diagnosed? The best way to diagnose hernia is clinical. By clinical examination, we are able to diagnose most of the hernias. Yeah, sometimes we also need help of the radiologist by means of ultrasound or CT scan to diagnose hernia. What if anything can be done to avoid hernia from coming back recurring? Unfortunately, nothing can be done to prevent recurrence. Only thing that can be done to prevent recurrence is, to get the treatment as early as possible and use good kind of mesh. What causes gallstones? As I have discussed, it's basically the dysfunction of the gallbladder wall that causes gallstones. If gallbladder doesn't contract properly, what happens? The bile gradually sediments and it leads to the formation of gallstones. Common viral hepatitis is fairly common. Hepatitis A, B, and E are fairly common. Hepatitis E is may sometimes may be very fulminant, especially in pregnant women. Hepatitis A is very common. जो जिसको हम commonly बोलते हैं ना jaundice हो गया, that is basically hepatitis A. Which hepatitis is difficult to treat? Hepatitis B, C, and D are difficult to treat. As I told you, hepatitis A and E are most of the time self-limiting, which doesn't require treatment in most of the cases. The whole purpose of treating hepatitis A and E is basically symptomatic treatment is given to the patient, maintenance of good hygiene, maintenance of proper hydration, and basically some symptomatic treatment like paracetamol and other medications for fever and other symptoms. How do you investigate gallbladder stones? The most common and most important investigation in diagnosis of gallbladder stone is ultrasound of the abdomen, which is a very safe investigation because ultrasound doesn't require any kind of radiation. So ultrasound is a safe and the best way to diagnose gallbladder stones. Sometimes we also require investigations like MRI. MRCP is basically a specialized form of MRI, which we need sometimes. Sometimes we also do endoscopic ultrasound. Sometimes other investigations like endoscopy is required to diagnose gallbladder stones. Unfortunately, gallstones, see, the question is, can gallstones go without surgery? Basically, in gallbladder stones, the aim of the treatment is not gallbladder stones. The aim of the treatment is basically the removal of the gallbladder. It is not the gallstones which causes the problem. It is basically the dysfunction of the gallbladder is faulty. So we don't need to remove the gallstones only. We need to remove the gallbladder. So the only treatment in gallbladder stones is removal of the gallbladder, not the stones. Yeah. Sometimes, if a patient is very sick, there's a perforation in the gallbladder and patient is not in a condition where we can do a proper surgery, then we basically sometimes go in and just remove the stones. If patient improves, then after a few weeks, we go in again and ultimately we have to remove the gallbladder in gallbladder stones. Which size of the gallbladder stone is dangerous? In fact, the smaller stones are more dangerous in gallbladder. As we have seen in the slides, the smaller stones can migrate to the bile duct and can cause obstructive jaundice or pancreatitis. It's not the size of the stone which basically matters in the gallbladder stones. The larger stones, the chances of gallbladder perforation and acute cholecystitis and cancer of the gallbladder are more. In smaller stones, the chances of pancreatitis and obstructive jaundice is more. Yeah, hepatitis, especially hepatitis E, is dangerous in pregnancy. What are the warning signs of hepatitis? The warning signs of hepatitis, what we call is prodromal symptoms, is basically, malaise, ठीक नहीं लग रहा है, तबीयत ठीक नहीं लग रही है, low grade fever, anorexia or loss of appetite. Any other questions? How do I know if my hernia is dangerous? every hernia is dangerous. So it's better to go and consult a surgeon. We should not take call on of ourselves. Sushmita, probably I have already answered your question. Hepatitis, especially hepatitis E, is dangerous in pregnancy. Thank you. Thank you, everyone.
Thank you, sir.
Bye.